Hey, Renew Education here. We're looking at a case study, and this is the part 2 to where do you start. Look at part 1 to figure out what this is about. We're looking at the lower arch in particular. We're going to look at the bone on the number 20 area. The treatment assessment part is the same. I didn't really change that. So quickly, that's a red bone density when we're looking at the upper for sure, ridge height, orange on the sinus, but orange on detached gingiva. And I would say, unfortunately, the nerve is in an orange position as well on the IA nerve. So let's look a little bit deeper into this number 20 area here. And you can see that the bone density really changes in this patient from upper to lower, but across the arch as well. So the bone looks pretty good. It's a little bit getting harder than I like, but this will definitely work. And we're getting closer to the nerve in this case. You can see the foramen right here. So, you know, when the bone density is a little bit homogeneous, it's hard to tell. This would be a pretty good, straightforward case. You just got to measure your drill and make sure you're not close to the nerve with the drill, not the implant length, but the drill length. So that's really, really important here. The other thing I talk about a lot is implants aren't everything. So you do have a traditional option here, just doing a 3-unit bridge. The patient already has 2 crowns. So I already mentioned, well, where do you start? So if this person has a decay here or decay here, there's so much blackout here, but clinically, then you would definitely offer up like a 3-unit bridge because they're one step closer to getting a chewing area here where they don't have anything to chew. Unfortunately, here you're stuck with implants for sure, and you got this time lapse of waiting for those to heal before they can actually chew. But here they get the chewing capacity right away if we had something up above. So I always consider that for the patient and the general care of things. And financially, I always want to make sure the patient understands the financial commitment between the two. In my office, I try to make a single tooth implant replacement the same cost as a 3-unit bridge, which runs about the $2,400 level. So I'm a little bit lower on the scale of a single implant, but I do so many implants in a particular arch like here. You know, I would rather see a person get 3 implants than 2 implants in a 3-unit bridge. So I'd rather have the prices low. It doesn't take me much longer to take impressions of 3 or place 3 implants in a particular situation in this case when they're doing the surgery. So that's why I always try to add that benefit to the patient there. So that's pretty straightforward on this side. Now let's go over to the right side. Okay, so if we go to the right side, let's look at the 28 area. And here's where you can see that the bone also has some very hard elements to it here. So I'm not really sure that's old tori or something, and then the bone becomes very soft. So this is a little bit tricky because you're going to knock that wall off. If your drill hits that, it just chews it up. There's not a lot of room for that drill. So let's go, ideally, let's say that's where the implant is. That's what it's going to look like. So you're going to do a lot of compressive technique here, and actually I would probably put a 3.5 in this site, and I would just open that up with the 2.0 running along the lingual wall with the drill, and I would then probably stop my drilling at a 2.5 or something, and then I would compress to a 3.5 and make sure I keep that facial plate intact. So that's how I would deal with number 28. And if you go to number 29 area, let's say that's about number 29 area, this gets a little bit more knife edge, and that's probably because she had a 3-unit bridge sometime. I don't know the entire history of this patient, but she had an extraction and then lost the facial plate, collapsed in. And so, but the bone density looks pretty good here. So if you could get a 3, let's just look, I'm kind of curious. Is a 3.5 going to work here? Is a 3.7 by 10? Let's throw that in there just to kind of get a very clear mindset on it. So you're going to have to really try to dig into that hard cortical bone, which is going to be impossible. Maybe if you used not a drill in this case, you can take a piezo surgical tool here and first you make your osteotomy, but then you really use that surgical tool to try to relieve some of that internal part of that cortical bone here. That's a very, very difficult thing to do, and unfortunately what's very hard is that those piezosurgical hard tissue surgical tools get very hot. So you definitely have to be very cautious if you're going to use something like that. But that's probably the only tool I could see to really get the implant in its proper location in the bone of this width with this type of characteristic of the bone. So if you have a piezosurgical bone tool, then that would be great. You want to use it in this case and just make sure you're constantly pulling it back in and out, so you have a constant flush and stream of saline that's going to be keeping everything cool so you don't burn the bone here. You should be successful after that. You could think about a ridge split here too. This is an excellent site for a ridge split because the bone on the facial plate is pretty pliable. You would be able to do that, except that when you get down into the molar position, you don't have a facial plate anymore and your nerve is here. So, you know, for the premolars, you could do it, but then you get into the molars, not so hot. So if you get a couple implants here, maybe you want a cantilever on the number 30 back here, but only with a premolar size tooth. That could work for a little while. It all depends on how hard this patient bites. If you're trying to get back here, let's say that's the molar site, this becomes very tricky. This is also one of those sites. Let's see, I think the nerve is right here, yeah. The nerve is here, and you're gonna try to build out that facial wall plate if you're really trying to do that, but I personally don't think you're gonna get a 5.0 here. I think you're gonna end up with at most a 4.0, 4.2 or something. Yeah, so you would be putting something in like that. I believe is that the nerve right there? Yeah. So it looks like the nerve is here. Let's see. Well, here's how I find the nerve if you're unclear, and because this is knocked off. So what I do is go with my CT. I go into like a small a very small slice view, so you can see the nerve here, and I will put my slice view marker right at the top of the nerve. Okay, so now I'll go back to my settings here, and now I can see when I get to that position of where I just put that implant, I can see where that nerve height is just by this cue here. So that's not where it is. It's lower than that. It's down here. It's right there. So why did that not work out too well? Let's see. Let's go back. Oh, I guess I didn't move it right. Yeah, because that's right here. So that's where our nerve is. Okay, so that did work out okay. Somehow I moved it or something moved. Anyway, so that's our nerve here. You don't want to impinge on it. This could be one of those cases I mentioned in other videos where you can do this titanium mesh that is like an abutment that screws on. You're going to get the stability on the implant here. You're going to want to use sinus drills for this to get that implant in. And then you do a titanium mesh and particulate graft, and that should heal over this site. I can't remember what the product's called, but it doesn't matter. You know what I mean. Hyasin carries this product, so you can look at them. I know some other companies have it as well. So take a look at a case like this. This is definitely, this is a little bit more of an advanced case when you look at where the IA nerve is, or when you're looking at where to put the placements. What I like about the case is that it's on your right side. If you're right-handed, it's pretty straightforward. You can still get those implants in. The bone is pretty soft. It's that lingual bone that's going to hold you up. You're going to be successful. It looks like if you get that bone back up in that corner, that would be really great. and it's definitely doable. So it's going to take a little bit of time in the surgery to get that done, but definitely can be done. And then that patient's also, if you're only looking at implants here and maybe here, this patient's one step away from a full arch, supportive full arch piece. So you've got implant, implant, and then you have implant, implant, and you can do a 4-locator overdenture if that patient starts to lose those lowers. Maybe even put an implant in here or something like that if you wanted to help stabilize that a little bit better. So not a bad case. Is a great case to kind of try out different things, different experiences. Definitely upper level of, if you're doing a lateral sinus lift up here or you're doing a titanium mesh down here, they will both be fairly successful because they're very straightforward cases. They're not something that's super crazy hard. But take a look at our other video, the part 1, but also we have other videos, obviously the case studies that talk about all of these things, so you can just search around for those as well. So great, thanks. Like us on Facebook and subscribe on our YouTube channel.